Best of Health, presented by Clarian Health, Methodist IU and Riley Hospitals.
This week, Dr. Tom Wozniak will be answering questions concerning lung disorders, starting with what is pulmonary emphysema?
Emphysema is basically chronic destruction of the lungs from one cause or another, most often cigarette smoking.
What does it feel like to have emphysema?
The best example that I can give for somebody is if you were to take a giant breath and hold that breath for as long as you can, and then when you're ready to release that breath, try to take another breath.
What is lung volume reduction surgery?
Lung volume reduction surgery is a procedure where you actually go in and, for lack of a better term, cut out some non-functioning lung to try to make the other functioning lung work more efficiently.
How many hospitals in Indiana are qualified to perform this procedure?
To be qualified, Medicare qualification is that the hospital has to have an active lung transplant program. So from that standpoint, Methodist Hospital is the only Medicare-approved site in the state.
What are the risks of this procedure?
A lot of them are just the general risks that you see with any type of lung surgery, anesthesia, ventilatory problems. Specifically in this patient population, you're going to see a lot of problems with what we call air leaks, poor healing of the lung tissue, lung infections, pneumonia.
How long does it take to recover from lung volume reduction surgery?
In an uncomplicated situation, most people will be out of the hospital within 10 to 14 days.
Can a person function with reduced air volume?
Well, that's the whole problem with emphysema. People have non-functioning lung tissue which inhibits the ability of the other part to work normally. So the theory of this is to take out that non-functioning lung to make the other work better. So yeah, it can help people dramatically.
Who is most at risk for emphysema?
Cigarette smokers, by far.
How do I know if I'm a candidate for lung volume reduction surgery?
The easiest way to make that determination is to be seen by a pulmonologist, which most of these people already have, a lung specialist who can evaluate what the extent of their lung function is, how much deterioration they've got, how much treatment they've had.
How does lung volume reduction surgery relate to transplant?
Well, a lot of people that are on our lung transplant waiting list, probably 60% of people waiting lung transplants, have emphysema. So there are a significant number of those people who are probably going to be good candidates for lung volume reduction surgery. As I mentioned earlier, not everyone that has emphysema is a good candidate for lung volume reduction surgery. Emphysema comes in a variety of shapes and sizes, and different people respond differently to different types of treatment.
If you have a health question, please call 1-800-265-3220.
For more information on this or other health topics, visit clarion.org or call 1-800-265-3220.
What we've discovered in treating the most critical cases has led to breakthroughs in the most common. So, while you may only be with us a short time, each visit reflects nearly 100 years of caring for the people of central Indiana. Methodist Hospital. The difference is our experience.